Hi, welcome to Buzz on Business. I'm Kristen Baum with RE/MAX, and I'm also on the board of the Northern Medina County Chamber Alliance. And today we're meeting with Nancy Peacock. She is the Executive Director of the Free Clinic of Medina, right? Medina
Right.
County, Medina?
Medina County.
Okay. And I'm excited for you to be here today so you can tell us a little bit more about your nonprofit, what you do there, what services you provide. So let's start with, where are you located?
Okay. Well, we are located in the Medina Hospital, Cleveland Clinic Medina Hospital. They provide a very nice series of medical offices, a really nice private medical office that we can see patients in. And that is a huge, huge bonus for us because we operate on a very small budget, and we've always been able to because of things like that. And all of our doctors, all of our nurses are all volunteer. So we are able to provide quite a bit on very little money.
All right, so the doctors and nurses that are there to volunteer their time to service the patients that come into the free clinic, are they all with the Medina Cleveland Clinic?
No, actually they're from University Hospital, they're from Southwest, they're from SUMA, they're from a number of places. Some are retired, some are still actively practicing. Both of our gynecologists are still in practice.
Wow.
So we have the very creme de la creme of medical people working for us, and they're doing it because it's why they went into medicine in the first place. Instead of being on someone else's schedule, now they're on their own. Now they can see a patient, they can ask about the family, they can take as much time as they need, and that's why they went into medicine to begin with. Same way with the nurses. They love volunteering at our clinic just because it's medicine as it should be practiced.
That's amazing. What kind of services do people, or do they come to you for?
We sort of offer ourselves as a family practice. All of our doctors, well, the majority of them are family practice, or we're in emergency medicine, and then we have a couple specialists, the gynecologists. But we want to be your family doctor. What happens is, once we are able to take you as a patient, we also sign you up for the Cleveland Clinic HCAP program, which is we are able then to refer our patients. Let's say you need any sort of specialist within the Cleveland Clinic healthcare system, you now have access to that for free. So all of your care is free. We don't even have a billing apparatus. We don't even go there.
I know you mentioned that there's a lot of residents in the northern part of Medina County that are unaware that this is available. So we are hoping to get the word out today about that. And let's talk about some of the qualifications that you look at for a patient to receive free care.
Okay, it's pretty simple. You have to either live or work in Medina County. It used to be that you had to live here, and then when COVID happened, we're like, nah, if you work here, that's all that counts, work or live. And then you need to be between 18 years old and 64, because that's the gap that we have found where people without health care insurance really suffer. You can be a very productive member of society, you can have a job, but if you don't have health care, that's the one place you're going to get killed if there's any sort of medical crisis going on. So what we try to make sure is that we have filled that gap. Once you're 64 and you're Medicare, you're pretty much taken care of. And before that, if you're younger than 18, Medicaid will cover you for that. So we have that very important segment of the population. So 18 to 64. But then, because we also do hook you up with the HCAP program through Cleveland Clinic, you need to be within 250% of the federal guidelines for income. So for example, one person in the household, you can make up to $36,450 and still be eligible for completely free health care. Now, if you have a child or if you're a family of 2, you can make up to $49,000 and still be eligible. And it goes up from there. 3, you can make up to $62,000 and still be eligible. And what we tell people is, rather than decide here and now, watching this, whether you're eligible, call the clinic, call me. I'll walk you through it. I'll help you figure it out. We are constantly looking for new patients. That's the only reason we exist, is to find new patients and help them. And so we really feel like there's a lot of people in the northern part of the county, Brunswick, Valley City, Hinckley, who need our services. They just don't know about them.
Yeah, it's so important. How can people get a hold of you?
It's very simple. We have a website, which is the letters of Free Clinic of Medina County. So it's fcomc.org. That's our website. Then if you want to call us, we're at 330-764-9300. And if you call us, there may not be someone at the clinic at that very moment. Leave a message. We will get back to you. We get back to you within a day or 2, and we will make sure that we connect with you. And if you're eligible, we will do the best we can to get you hooked up. And if you're not eligible, we'll also say, okay, you're not eligible for us, but here, you go here or you go there. The health department, the Medina County Health Department, and the free clinic, we're constantly referring patients back and forth. So if we can't help you, we'll find someone who can.
Awesome. Well, I can tell how passionate you are about what you do, and you've been there for 4 years. So if you have any questions, reach out to Nancy. Thank you so much for your time today.
Thank you so much. And please let everyone know they are welcome in our clinic.
I will. All right. Thanks for joining us, and we'll be right back.
It's important to get a flu shot each and every year because flu viruses are constantly changing and immunity from the vaccine decreases over time. Flu vaccines are updated annually to work against that year's viruses. The best time to get your shot is in the fall, but getting it later can still help. Getting a flu shot lowers your risk of getting sick, and if you do happen to get flu, it's likely to be less severe.